So I qualified at the University of Cape Town 10 years ago. I'm so fortunate and so happy that I got the opportunity to study in Cape Town. I feel like I got world-class medical training. I went to school here in Port Elizabeth. My primary school was at St. Dominic's Priory. I went to Collegiate Girls High School and matriculated there. I met my husband in high school. He went to Grey High School. We have a beautiful 8-year-old girl who now goes to collegiate as well. Quite the feisty little girl, who often thinks she's the mom in the family. My husbandship was spent in here in PE, so I spent a lot of time in Livingston and Dorangenza. In both hospitals, I spent general medicine. I did some casualty work, did obstetrics and gynae, so delivered a few babies. Also did pediatrics, loved the kids. General surgery as well. Later on, I did my community service in family medicine, and I was in East London. So I really feel like I had the opportunity to have a more all-rounded experience, different parts of society. And I think that's really helped me be a more grounded and more approachable person. I arrived in the UK at the peak of the pandemic. I got the wonderful opportunity to work for an online medical company where I could do online consultations. Medicine's the same. Wherever you are in the world, people still present with the same conditions. And I thoroughly enjoyed it. And it's a platform that now we offer in our practice, where patients can do online bookings and we can do online consultations, send the scripts electronically, and you can still feel better in the comfort of your own home. We live such busy lives, so technology has honestly afforded us the wonderful opportunity to be able to still feel better wherever we are. I have 5 years experience in the emergency units, so mostly I spent some of them in Johannesburg, some years at Olivedale Netcare, and that's in Randburg. I've also spent some time in Santon Mediclinic. When I moved to PE, I moved around at all of the units. So it's been Greenacres Netcare Hospital, St. George's Life Hospital, and Mercantile Life Hospital. So I got the opportunity to network and meet with almost all the specialists, so I know who to go to when. I've also just managed to see almost everything in the emergency unit, and I think I love the rush of the adrenaline, knowing that anything can come in at any time.
Didn't you panic at times?
Oh, there'll always be a panic, but you can't show it. Because the patients are there because they want to trust you and they need healing from you. And it's often not just the patients that you're dealing with, it's also the family members that are there that are very anxious. So they need to know that they're there with someone who's comfortable and that can look after their families.
What do you think that allows you to bring to family general practice?
So I love that patients, when they come to the practice, they also come into someone with an all-round experience, and that they can come here for a cut that can be stitched up rather than wait 5 hours in casualty while the doctors there are dealing with other emergencies. They can come here when they feel like there's something they're not sure of whether or not it is an emergency or not, and they'll be in the best care, and when they come here, we'll also be able to escalate their care to the appropriate specialist, because what's important is what the patients need. Feelings about intimidation or egos doesn't matter, there's no place for it.